UK health and social care employers, including local authorities, contracting bodies, recruitment organizations, agencies, collaborations, subcontractors target individuals to market UK employment opportunities with the intention of recruiting to a role in the UK health or social care sector. It includes both physical or virtual targeting and whether or not these actions lead to substantive employment. Now, this includes but not limited to allied health professionals, care workers, dentists, doctors, healthcare scientists, medical staff, midwives, nursing staff, residential or domiciliary care workers, social workers, and support staff. Now, in 2021, the UK suspended the recruitment of healthcare workers from Nigeria and 46 other countries, noting that the increasing scale of health and social care worker migration from lower and lower middle income countries threatens the achievement of their nation's health and social care goals. WHO earlier, last month, March 8, 2023, listed Nigeria and other 54 countries as facing the most pressing health workforce challenges related to universal health coverage. Now, the red number country list does not, however, prevent individual health or social care personnel resident in countries on the list from making a direct application to health and social care employers, but rather without being targeted by third parties such as a recruitment organization, agency, or recruitment collaboration. Now, there are currently over 11,000 Nigerian trained doctors in the UK, based on data from the UK General Medical Council. Nigeria has the third highest number of foreign doctors working in the UK after India and Pakistan. Let's talk about this for a bit. So, to help Nigeria achieve its universal healthcare coverage goals, or at least those goals set by the WHO or other international agencies for the country, the UK is saying we're no longer going to poach healthcare workers in Nigeria. We're not going to do that. We're not going to make any effort either physically or virtually to try to get them employment in the UK. However, what you have noticed, it does not bar medical personnel or those in the medical field from applying for jobs in the UK. They can still do that, but neither will the UK government or any third parties or any other organization, they are told to not do that. Whether or not they will abide by that is a different thing entirely, but they are told to not make any efforts to poach Nigerian medical workers. But the medical workers, once again, can apply for jobs, existing jobs in the UK. What impact do you suppose this might have? If it would have any impact at all, what impact would it have on Nigeria's healthcare sector? Let's talk about this. The lines are open. Call 070-0923-0923. Preferably do call 0817 923 0002 or 0817 923 0003 or 0817 923 0007. We're live on facebook.com/Nigeria Info PH. We're also live on Twitter at Nigeria Info PH. What's your take on this development? Would it have any noticeable impact? Remember as well that I think recently there's some legislation, some bill before the National Assembly. I think the House of Reps. The bill has crossed first reading. I think it's about second reading or has crossed second reading stage. The bill proposes that doctors and dentists, I think, are the ones who are being targeted first. After the conclusion of their training in Nigeria, must work for 5 years within the country before they can emigrate or before they can go work elsewhere. Before they can be fully licensed, I think is what the bill is targeting or proposes. Before they can be fully licensed to practice, they must first have worked for 5 years in the country. But the UK has done this, but then again, it remains to be seen whether that is going to be followed through. Well, the UK government might do that, but what's to stop private establishment or third-party contractors from going ahead to try to poach them? But even if they all abide, even if the UK government, private contractors, third-party contractors, all of them abide by this and decide not to poach Nigerian medical personnel. The UK is not the only place that they go to. They go to the US as well. They go to the Middle East also. I think, was it about a year or two ago? I think maybe about 2 years ago now. It was widely reported that Saudi Arabia, I think it was Saudi Arabia, was in the country to poach Nigerian doctors. If I remember correctly, I think that was even quite somewhat embarrassing to the Nigerian government, and I think some steps were taken at that time. I remember it was widely reported even a professor of medicine was standing in line as well to try to jackba to Saudi Arabia also. I think some, if I remember correctly, a female doctor standing in line to be attended to have her documents verified, saw her professor, medical professor who taught her in medical school, standing on the line also. He also was trying to jackba to Saudi Arabia. I think it was Saudi Arabia. If I got that wrong, please correct me. Well, I will confirm it shortly. Just trying to confirm that, by the way. Oh yes, it was in 2021, I think it was. Yes, 2021. Yeah, it was sometime in 2021. Saudi Arabia. Yeah, this is from Daily Trust. This was published sometime in 2021, August 2021 is precisely. Brain drain. Over 500 Nigerian doctors take Saudi recruitment test in Abuja. Yes, indeed. Yeah. That was it. It was 2021. Yeah. So that happened. So the point is, they're not just going to the UK. They're going to Saudi Arabia. They're going to, some are even going to Asia. You know, they're going to different parts of the world. They're going to Australia as well. They're going to Australia. They're going to Canada also. They're going to different parts of the world. So, anyways, the step taken by the UK on this, you know, once again, the story. UK stops recruiting healthcare workers from Nigeria and 53 other countries. Would it have any impact on Nigeria's healthcare system? If we suppose that it would, what impact would it have? Let's get to take once again. Numbers to call 0817 923 0002, 0817 923 0003, or 0817 923 0007. We're live on facebook.com/NigeriaInfoPH. We're also live on Twitter at NigeriaInfoPH. Via Facebook, Adelaide Bernard goes, UK should not only suspend Nigerian health practitioners, but also Nigerian patients. Nigeria should awake. What do you mean by suspend Nigerian patients? I'm not sure I understand that. Oh, I think you mean Nigerian patients. Oh, not patients. Okay, I think you mean Nigerian patients. Well, why stop Nigerian patients? Some people actually are in need of critical, you know, some people are in a critical condition and they actually do need foreign medical attention. And I'm not talking about people who, Honourables or Excellencies, who travel out to see when they have a headache on state expense. No, I'm talking about people who actually need it, who need to go overseas for some, you know, experts medical attention that may not be available locally. These are people who may even have to go out of their way to raise the money for that. Ordinarily, they couldn't afford it, but because, I mean, it's possibly a life or death situation, they go through some extraneous measures to actually raise the funding for that. I'm not sure, you know, suspending or banning patients from Nigeria will be the right way to go. Hello, Hard Factor, welcome.
Hello, Mr. Richard, good evening.
Hello, go on.
Yes, UK put red alert. For me, it's a welcome development, and it's also a clear call to our government to look at the health sector and do whatever that is necessary to equip our health sector, and also look at the welfare and packages of the medical personnel. Why are they moving to foreign land? It's for greener pasture, and whereby their country is not giving them what they are supposed to be given. Look at the COVID allowances. Up to today, some of them did not receive it, and that is where we are getting it wrong. Now, the UK has said that the UK should also try in as much as to see how they can also, there will be great red alert for our government personnel not to travel to foreign countries for health challenges. Anyone that have health challenges, not to go for medical treatment. I think if that should be done, they will also look at inward. They will look at inward to equip our health sector. For the National Assembly that's coming up to say they are not going to give them license for about 5 years. That is not enough. They should be able to look at our health sector and upgrade our health sector, and also put a barrier that any standing assembly member, national assembly member, governor or president shouldn't go outside for medical treatment. They should be able to patronize the country when it comes to an health sector. So that I think that our health sector will be upgraded. It's not just the doctors. We have about 10,000 for one doctor. And that is a very critical national importance.
No, that's the much that I can take from you. Thanks for your contribution. I do have a commercial break coming up shortly, and I'll return right after that. Discussions will continue. UK stops recruiting healthcare workers from Nigeria, 53 others. What impact would this have on Nigeria's healthcare sector? And how about the medical workers themselves? Is this good for them? I'd like to hear from you when I return. Stick around.
To thrive in a fast-changing world, tune
with Diode.
Welcome back. 26 minutes gone past 4 p.m. Happy Easter once again. It is Hard Facts, originating from your number one talk station, 92.3 Nigeria Info. I'm Dial, and let's talk. UK stops recruiting health workers from Nigeria and 53 other countries. The UK has placed Nigeria and 53 other countries on the red list of countries that should not be actively targeted for recruitment by health and social care employers. The announcement is contained in the revised code of practice for the international recruitment of health and social care personnel in England. And the code of practice applies to the appointment of all international health and social care personnel in the UK, including all permanent, temporary and locum staff in clinical and non-clinical settings. Now, you might remember in 2021, the UK suspended the recruitment of healthcare workers from Nigeria and 46 other countries, noting the increasing scale of health and social care worker migration from low and lower middle income countries threatens the achievement of their nation's health and social care goals. Now, the WHO on March 8, 2023 listed Nigeria and other 54 countries as facing the most pressing health workforce challenges related to universal health coverage. But the red and amber country list does not, however, prevent individual health and social care personnel resident in countries on the list from making a direct application to health and social care employers, but rather without being targeted by a third party such as a recruitment organization, agency, or recruitment collaboration. There are currently over 11,000 Nigerian trained doctors in the UK. Nigeria also has the third highest number of foreign doctors working in the UK after India and Pakistan. Let's talk about this for a bit. What effect will this have on Nigeria's healthcare sector? And if you're in the medical field, or you're even thinking of going to the medical field, how do you think about it? What do you make of this? How do you feel about this development? Maybe you were even thinking of, emigrating or migrating to the UK yourself lately. How do you feel about this development? I'd like to hear from you as well. If you're on the medical sector and you were thinking of leaving the country soon, maybe to the UK, maybe somewhere else, maybe the UK. How do you feel about this development? Lines open again. Call 0817 93 0002, 0817 93 0003 or 0007. Via Facebook, Emmanuel Iberi goes, good PM. I've been laughing about this, my professor standing in line to Japa. But personally, I feel it's an infringement of the rights of our doctors. I mean, these men burn midnight candles, miles away from sleep, striving to be relevant. Some staff walk for miles, put up with their corrupt lecturers, and when they finally win, you try to state where they practice. Me, I'm working to be a doctor and I have decided to practice abroad. I don't care about what they say. Well, Emmanuel, you may not care, but if the bill before the House of Reps sails through, if it becomes law, even when you're done with your medical studies here in Nigeria, you will not be fully licensed to practice if you don't work here for 5 years. But maybe Emmanuel Iberi doesn't mind. Maybe he does, fine. I'll give Nigeria the 5 years, and at the end of the 5 years, I'm gone. What's the law? Is gone. Maybe that's what Emmanuel thinks. Well, Emmanuel, I'd like to get a reply from you on that. Also, you can join via Twitter as well, at Nigeria InfoPH. I believe we're live there as well. Let's take a few more comments now. This is not a welcome development at all. This is a misdirected aggression. These medical personnel are ordinary Nigerians like you and me. UK government should rather stop the medical tourism by our honourables. They should be forced to stay back in the country and develop the sector, but they won't because it's fetching them cool money. That's a maniac here. When you say misdirected aggression, who is the aggressor here, Aniete? Are you suggesting that the UK government is being aggressive? Aggressive why? By the way, they need the medical personnel. That's where they're recruiting them. Or maybe there's something you're seeing that I'm not seeing. How is the UK being aggressive here? Not a message. They should also suspend those Nigerian patients that get sick once they are accused of some form of embezzlement or the other. That's from Ubong. Those are strange illnesses, strange diseases. So whenever ICPC or EFCC indicts an honourable and excellency, they will suddenly develop an illness that requires foreign medical attention. And if permission is not granted early enough to go for this foreign medical attention, The next time they're seen publicly, maybe in court, they're going to be on a wheelchair, or they're going to be using crutches, or sometimes, in some extreme cases, they're going to arrive court on a stretcher. And I've always said, I haven't seen this yet, but I just have a feeling that it's only a matter of time before a Nigerian honorable pulls it off. Arriving in a helicopter and being lowered down via stretcher. I'm telling you, that would be something. Arriving court in an air ambulance, but the helicopter would not be able to land, so they have to use some kind of a pulley system or a rope, to lower His Excellency from the helicopter, while he's on a stretcher or a gurney, so he can attend court. But I definitely wouldn't put it past them. No, I would not. The line's still open to get your thoughts on the matter at hand. If you're willing to join the conversation, I guess I'll go for a break now and I'll return shortly. I'll return in a bit. The conversation will continue. Do please stay with us.
Politics, business.
Welcome back. 18 minutes to go before 5 o'clock. The news update is at 5. Still 92.3 Nigeria Info here in Port Harcourt, your number one talk station. I'm Dial. Let's talk. UK stops recruiting healthcare workers from Nigeria and 53 other countries. The UK has placed Nigeria and 53 other countries on the red list of countries that should not be actively targeted for recruitment by health and social care employers. The announcement is contained in the revised code of practice for the international recruitment of health and social care personnel in England. It's recommended that employers, recruitment organizations, agencies, collaborations, and contracting bodies check the red country list for updates before any recruitment drive. In 2021, the UK suspended the recruitment of healthcare workers from Nigeria and 46 other countries, noting that the increasing scale of health and social care worker migration from low and lower middle income countries threatens the achievement of the nation's health and social care goals. Also, WHO on March 8, 2023 listed Nigeria and 54 other countries as facing the most pressing health workforce challenges related to universal health coverage. But the red and amber country list does not, however, prevent individual health and social care personnel residents in countries on the list from making a direct application to health and social care employers, but rather without being targeted by third parties such as a recruitment organization, agency, or recruitment collaboration. There are currently over 11,000 Nigerian trained doctors in the UK, and also Nigeria has the third highest number of foreign doctors working in the UK after India and Pakistan. What do you make of this situation? And what impact might this, if any at all, have on Nigeria's healthcare system? And if you're a medical worker, what do you make of this as well? Maybe you or someone you know is thinking of relocating to go work someplace else, maybe the UK, for example. Also, remember that there's a bill before the House of Reps seeking to compel, or mandate that medical personnel trained in Nigeria. I think the bill targets doctors and dentists, at least initially. Upon finishing their training, must work for 5 years in the country before they are fully licensed. Once again, call 087 Nigerian for PH. We're live on Twitter at Nigerian for PH. Emmanuel Ibera is back, says, Dio, no, nothing like 5 years. Me, I'll Japa, I'll follow my professor and stand on the line. Well, if once again, if the bill becomes law, I don't think it's then subject to your opinion or what you want any longer, except you don't want to be fully licensed. And if you're not fully licensed to practice here, I don't think you're going to be licensed to practice in the UK, except you want to go start your studies all over again in the UK. Via Facebook, Barry Poa Dum Nebari goes, this is very bad news to my colleagues that have done the relevant registrations with HCPC and we're planning to move later this year. Well, okay, you know what? I think I'll just Google that. What do you mean by, what is the HCPC? I really don't know. So let's do a quick Google search. Let's find out what HCPC is. HCPC. What exactly is HCPC? Okay, HCPC is the Health and Care Professions Council, formerly the Health Professions Council, is a statutory regulator of over 280,000 professionals from 15 health and care professionals in the UK. Okay, well, if persons have been targeted, Barry Poa, if medical personnel have been targeted already before now, because the UK is just recently putting this into play. So if they have been targeted already, and by the way, I need to clarify, Barry Poa, this does not mean that medical personnel in Nigeria cannot work in the UK. Even now, they can still work in the UK. Even now, they can leave tomorrow. They can leave after the holidays. They can leave next month. They can leave in December. They can leave next year to go work there. What the UK government is saying is, we, neither us nor our proxies, will deliberately target medical personnel in Nigeria. We will not embark on any recruitment drive in Nigeria. Note also, it doesn't state that they cannot apply. So you or your colleagues, if you are aware of any opening in a hospital or any medical, care organization in the UK, you can, if they are receiving applications from different parts of the world, including Nigeria, if they are receiving international applications, you can apply. But you will not find the UK government or any of its proxies or any third-party organization working for medical outfits in the UK come to Nigeria to hold some kind of recruitment exercise. Neither will they do it online or virtually either. That will not happen, at least for the foreseeable future. But if you and your colleagues are aware of any opening and choose to apply, you can do that. However, for those who may have been contacted before now and who may have commenced registrations with the HCPC, I'm sure this does not affect them in any way. So if they were contacted and if there were or attempts were made to recruit them, and based on that contact, they've commenced or concluded registrations with the HCPC, they are not affected by this. Hallelujah, somebody. Barack Boagos, thanks for the clarification. You're very welcome. All right, the line's still open if you got something you'd like to add to this, or might as well wrap this up shortly. We got the news updates coming up top of the hour at 5 o'clock, a reminder of that, and when I return, we delve into a matter. Set discussion, by the way, after the news update. Let's see, where is that? Lawyers have been blamed for the PDP protest at the INEC office in Port Harcourt. We're going to be looking at that. And specifically, lawyer Liborius Oshoma is the one blaming his fellow lawyers for the protest by the PDP at the INEC office in Port Harcourt. He's also said INEC and the judiciary should not take blame for the crisis in the electoral system. However, Deputy Director of the Community Initiative for Enhanced Peace and Development, Egondu Ogbalo, says INEC is to be blamed for the post-election violence in Rivers State. I'd like to get your take. Who's responsible for this post-election violence in Rivers State? The PDP laying siege at the INEC office and doing whatever it is they're doing there. Who would you hold responsible for this? I'd like to get your take on that when I return. After the news update, of course, that is, which comes up top of the hour at 5 p.m. Before wrapping this up, maybe a few more comments. Let's see. Good evening and happy Easter to you. Dio, if UK government is targeting Nigerian health workers in this regard, they should also stop Nigerian politicians from coming to UK for medical emergency. Reasons are simple. Our doctors and other health workers are underpaid here in Nigeria, but when they go overseas with the same certificate, they are recognized. So I agree with the message you read earlier, saying that UK government should stop political class seeking medical treatment outside Nigeria, as the same Nigerian doctors that would treat them abroad are here in Nigerian hospitals waiting for them for 5 years. That's from Emmanuel. Okay, that's that. Once again, when I return, who's responsible for the political brouhaha in Rivers State, or the post-election political brouhaha in Rivers State, and especially the PDP laying siege to the INEC office in Port Harcourt? When I return, to stay with us.